Hello everyone, and welcome to our webinar on leading practices for a successful health and safety implementation. Thank you for taking the time out of your day to join with us and walk through our webinar today. So before we go any further, I'd love to introduce myself. My name is Claire Russell. I'm an outbound product manager for workplace service delivery, and I'm joined here with Allison, who's our director of outbound product management for workplace service delivery, and Shayna, who is our inbound product manager for health and safety. So we are very excited to have you all here today and go through our health and safety offering. Our agenda and what we'll cover today, we will first do a welcome, some housekeeping items, just level set some of how our webinar will go. We will then have Allison cover an understanding of ServiceNow's health and safety strategy. Shayna will pick up and we will see a functional overview of our health and safety product. And then at the end, I will cover our implementation tips. At any point, please feel free to put questions in the chat down below in the Q&A area, and we will cover all of those questions at the end. So I will cover our safe harbor. Everything that we are showing today will be under safe harbor. We might cover some things that are forward-looking facing, and as we go through with our strategy, those might change. So that is covered under safe harbor. And if you do enjoy our webinar today, please feel free to scan this QR code, and a link will be shared in the chat below for other live on ServiceNow series. That link will take you out to a wealth of other ServiceNow webinars that are being hosted. So some housekeeping items today. Please feel free or please stay on mute throughout our presentation today. There is going to be that Q&A at the end of our presentation, so make sure you're using the Q&A feature to ask questions throughout the session. The chat, you can react, give thoughts, but if you have an actual question, please use the question and answer section. Feel free to introduce yourself when asking a question. We'd love to know who you are, and our session will be recorded and shared on the ServiceNow community forum. So if your colleagues would like to watch this webinar afterwards, if you'd like to go back and watch it, you have to drop off. There will be a recording for you to look at after this is done. And then after the session, you'll be prompted to fill out a survey. We appreciate any of your feedback. Again, thank you so much for joining our webinar today. So with that, I will pass over to Allison to introduce ServiceNow's health and safety strategy.
Great. Thank you, Claire. So I'm going to take the next couple of minutes to paint the picture of our strategy around health and safety. And where I typically like to start these conversations is by defining the topic, just to make sure that we are all on the same page. So if we look at this slide, on the left, we have the OSHA definition of health and safety programs. And I won't read through it word for word, but you can see that the primary goal that's articulated here is twofold. So first, it's to prevent workplace injuries, illness, and in really unfortunate circumstances, deaths. And it's also around the prevention of the suffering and hardship that these types of events can really cause for employees, their families, and employers by proxy. And these hardships really span from being physical, emotional, and financial. And if we look over to the right of the slide, in the ServiceNow context, in our ServiceNow world, our health and safety product really aims to do three main things. So first, we aim to make safety accessible to all. So what that means is that we enable employees to be equipped with information on safety policies and protocol via our Employee Center portal and our Now mobile app. And we also enable them to report an incident or an observation very easily via those same channels. Second, we also enable the record keeping, the thorough tracking, and really the reporting of incidents for health and safety professionals. We know that these incidents and the investigation that is associated with these incidents can often be very complex. And so structure and workflow is absolutely needed for those health and safety professionals who are really triaging and working through those details. And then third, over time, this really helps our customers with the framework and the data that they need to really prevent and reduce those incidents and those downstream impacts that I spoke about before. So now that I've talked about what health and safety is, I want to go through a couple of quick facts. And first, I want to talk about some of our history here. So our health and safety product is actually a strategic evolution of what some of you may know as the Safe Workplace Suite. So this was released amidst the pandemic back in 2020 to really address the urgent needs of the world. So this release initially included applications like health verification, contact tracing, vaccination status, and more. And since the pandemic, there has been a lot of reflection from all of us, so our customers, our product team, around the importance of employee health and safety, and of course, knowing that it's about a lot more than the pandemic. So that really leads us to the genesis of health and safety incident management, which is really what we're focusing on today. And this was just released in late 2022 to again deepen our investment in that area that we just got started with Safe Workplace. And then finally, another quick fact that I want to cover off on, I know it's typically a frequently asked question, is packaging. Many of you may be wondering about how you purchase this if you don't already own it. We do have a specific dedicated health and safety package. And this is also something that's bundled within our workplace service delivery professional and enterprise packages here at ServiceNow. But I will always give the disclaimer, if you have specific questions about your license or packet questions, please do speak to your ServiceNow account team, but just wanted to cover off that we have those 3 packages available. So another topic that I want to highlight is why ServiceNow has actually decided to create a purpose-built solution for health and safety specifically. There are, of course, a couple of reasons. So at the highest level, we have a core belief that keeping employees safe and reducing incident risk is critically important. We also know that health and safety incidents can be very sensitive in nature. We know that they can be complex, and we know that they often span the enterprise. Safety is often everyone's responsibility and accountability, and it touches multiple organizations. And these are all topics that we can help solve with the power of our ServiceNow platform. And this specific topic of why this purpose-built solution exists within ServiceNow will continue to come to life throughout today's webinar as we go through the functional overview and some of those implementation tips. You'll see how we solve some of these challenges. But next, I want to go back to that core belief that I mentioned a moment ago around health and safety being critically important. And I want to go to the next slide and highlight that tomorrow is actually World Day for Safety and Health at Work per the International Labor Organization, or ILO for short. So last June, the ILO actually declared a safe and healthy working environment as a fundamental principle and right at work. And so what tomorrow really celebrates is not only this decision and change, but it opens up the discussion on how employers and organizations can actually practically implement this right. And so where I want to close this strategy session is by talking about how we at ServiceNow with our health and safety solution actually help you practically implement this right. And so if we can progress to the next slide, we've kind of called that out. So first and foremost, we're really helping you manage a safe workplace. And how we're doing that is we're helping you standardize your process with workflow. Like I mentioned earlier, these health and safety incidents can be very complex in nature, and I mentioned that workflow is absolutely needed. So that's driving that organization and that process and those outcomes. And it's also allowing you to really continually monitor and improve your process. Data and visibility into that process is critical to help drive that. And through both of those, we're really helping you minimize that incident impact through better planning. The other thing that we're really practically helping you do to implement this principle is we are helping you drive a culture of safety. So this goes back to some of what I talked about earlier around making safety accessible to all. So we're really helping you engage your employees and making safety a natural part of that workplace. It's easily accessible. Employees can quickly find that information or make reports. Through that, we're also driving productivity. Employees aren't having to search to find out where they go to report a safety incident or where they can access that information. And we're also helping break down those organizational silos and improving that collaboration for the employee and your health and safety professionals. Because like I said, this is something that typically spans across the enterprise, and it's not just your core EHS or health and safety team that's owning this. There are lots of departments that can be involved. So with that, I want to pass it over to Shayna, and I want Shayna to continue to bring some of these concepts to life by going through a functional overview. So Shayna, over to you. And I think you're on mute, Shayna. We see you, but we can't hear you.
Sorry about that.
There we go.
Thank you, Alison. Okay. Hi, my name is Shayna Smallwood. I'm the inbound product manager on health and safety. And today I'm introducing some updates to health and safety incident management from ServiceNow. Our safety incident management solution provides capabilities to empower your employees with tools to self-report incidents and observations from any device using the Employee Center or now mobile. Incident records move into our safety workspace, where the safety team members will use some powerful tools to investigate these incidents, and mitigation is applied through an easy-to-use root cause analysis tool and assignable corrective and preventive actions. As part of this mitigation process, safety training can be assigned as a preventive action, and we provide a knowledge base where your safety content can be accessed by employees to further strengthen your safety culture. The number one aim of this process is to reduce injuries, incidents, and safety costs, giving your employees a safe working space and the security of knowing that their workplace safety is taken seriously. In Employee Center, we provide health and safety topics, including incident and observation catalogs. From here, an employee with a health and safety requester role can instantly report a safety incident and attach a photo directly from their phone camera. This will appear in the health and safety incident management workspace, ready to be investigated. These incidents and observation topics are accessible on your computer or through your mobile device. We also provide a knowledge base for safety where you can store all your safety policies and procedures centrally for all employees to access. Our safety incident management workspace is where the incident investigation and mitigation happens. So safety managers and safety agents will be using this workspace to log injuries and illnesses, upload witness statements and findings, assign related assets, and use our root cause analysis tool. Corrective actions and preventive actions will be created and assigned to mitigate the incident and prevent incidents from happening again. And in the latest release, injuries and illnesses can be generated independently of incidents and managed from our new injury and illness list view. Multiple injuries can then later be assigned to an incident. The Safety Incident Management Workspace has a landing page that we can see here, and it provides clear safety metrics to give safety team members a quick at-a-glance view of incident rates and other key metrics, as well as outstanding safety task lists. So you'll see that we have total recordable incident rates, days away restricted or transferred rates, and a number of other metrics on this landing page. These all use PA metrics, and those indicators can be customized as required. Along with this release, we have launched the optional OSHA plugin for health and safety. We've provided a new safety compliance user role in our latest release, which is required to use these features included in the OSHA plugin. And this new role can review the injury and illness list and manage the list of recordables. So they can review each injury and illness and make sure that that is deemed recordable in the correct manner. And users with this role can export their annual OSHA 300 log and also export the OSHA 301 incident reports from individual injury records. They can also export their OSHA 300 summary counts for the year. We've also provided a new establishment list where these reports will be stored per establishment, and this establishment list will be managed and kept track of and handled by the safety compliance manager role. Okay, so we've seen some screenshots of the application. Now let's jump in and see it in action. So one moment as I share my screen. Okay, so this is the ServiceNow workspace in Employee Center, or sorry, this is the ServiceNow Employee Center. And when you log into Employee Center and you have your health and safety application installed, you'll see this menu on the top left. So clicking this menu gives you straight away access directly to the main topics in the health and safety application. So we've got our health and safety incidents, health and safety observations, and then we have a knowledge base where you can store all of your health and safety policies and procedures in a central location for all of your employees to access. If you really quickly need to access a health and safety incident or an observation and submit that straight away, you can access those from the quick links. Today, let's have a look at the main health and safety page, which you'll get to by clicking this button here. And it brings you straight into the main health and safety page in Employee Center. You can see those 3 topics that we mentioned from the menu are listed at the top. And below here, we've got a lot of different catalog items that cover all of our various different health and safety topics, including different types of incident submissions that you would do and observations. You'll also see some of the policies and procedures. We provide some placeholders, but you'll be putting in all of your different knowledge base articles related to safety into that policies and procedures section. So jumping into the incidents topic, you can see that we've got 9 different catalog items here. You're not limited to these 9, nor do you need to use or display all 9 of these. So we provide a list of various different categories of incident and also observation, and you can choose to hide or display those, and you can also add new categories to that list if you need to. Today, let's jump in and have a look at an injury and illness. So in order to submit your injury and illness, you click the catalog item, as I just did, and simply enter what you need to enter here. So we can say, Joe slipped in a puddle near the main entrance. Choose the name of the person that is affected. The date and time will be automatically populated, but if you need to adjust it, you can use the little calendar here to choose the date and also choose the time. And we can also enter the location here. If you have any attachments, you can add the attachments here. So for instance, if there was a wet floor, this is the floor he probably slipped in, you can add that attachment. If you're doing this from a mobile device, either on Employee Center as a web responsive application or using our native app, you'll have access to the camera on your phone, so you can directly take a photograph or a video and attach it directly to this incident record. I'll click submit. Straight away, that has gone through to the workspace where the safety team members can conduct their investigation. So I'm going to move from this persona now to one of the personas who'll be conducting the investigation. So Champ Gibson is a member of the safety team. And we will jump over to see his view when he logs into Workspace. So if I jump back to the main workspace on this instance, to get to health and safety, you should be able to see it here by clicking on Workspaces, and then you'll see Health and Safety Workspace, or you can also search for it in the All section here by just typing in Health and Safety in the filter. So let's jump into the Workspace. And this is the landing page that you will see as a safety team member. So we've got our days away metric at the top here. We've got our total recordable incident rate. We've got some counts of risk assessments and near misses. Days since last injury. We've got incidents that are broken down by location. We've got our investigations. We also have open actions by assignment group, and you can see the different groups that they're assigned to. And down here, we've got some actionable tasks for me. So we've got everything that's been assigned to me, whether it's a corrective or preventive action, an actual investigation or an incident record. And then we've got my adjacent work. So anything that's been assigned to any of my team members, I could perhaps take over one of these tasks if one of my team members is on PTO or they're on sick leave or something like that. So it's very useful for me to be able to see this here. Let's jump into the list section. And in the list section, we can see that we've got lists of all of the safety incidents in the system, observations. We have a new injury and illness list, which is now its own list. In previous versions, we needed to drill down through safety incidents to get to these injuries and illnesses. But now we have a standalone injury and illness list, and we can create injuries and illnesses on this list individually, separately from incidents, and then retroactively associate them with incidents if it turns out that there's an injury that was caused by an incident that happened a few days beforehand or something like that. We also have a list of all of our actions. So any actions that were created are going to go in this list as well. So let's jump into the incidents list, and let's take a look at Jim's unfortunate incident with the forklift. So this gives you an idea of what the incident record looks like once it comes into the workspace. And it will come in with some basic information, but the person from the safety team may decide to add more details to it, prioritize it, basically triage this incident before assigning it to a group or assigning it to a specific person within that group. We also have a watch list, and all of the activity that has happened on this record is going to be tracked here. So We have comments that are public, that are visible to the person who submitted the incident in Employee Center. And then we have private work notes. And you can see that they have a different icon to highlight which are private and which are public. So we can put in some comments here that will go back to the person who submitted it. We can also see the photograph or any attachments that the person who submitted the incident attached to the record. And we can also attach our own attachments from here as well. So we can add as many attachments as are required. First thing we probably want to do in an incident such as this is create an injury and illness record. This is how that record looks. We've got employee and healthcare information on the left. We've got the more specific injury information on the center column here. And we also have a visual injury picker here. So we've got basically like a mannequin where you can choose the different body parts. So you can see already we've got a broken thumb log, we've got a broken ankle, and we've got severities with colors to match those severities. We can also click on the visual body part picker to zoom into areas to pick more specific regions of the body or body parts. We also have attachments here. For instance, in this case, we've got a medical leave cert attached. And you'll see that we also have an OSHA 301 form attached, which I'll show you how to generate in a minute or so. So jumping back to the main incident, we also have investigations. So you may want to conduct an investigation into why this happened and put some corrective or preventive actions in place. What we have here is the investigation workbench. The investigation workbench keeps all of the artifacts that you need to conduct your investigation in one place, nice and easily laid out. First of all, we've got our sequence of events. You're probably going to be coming and revisiting this as you gather findings, as you talk to people involved and gather witness statements and things like that. Your sequence of events is probably going to be updated. You'll do that by jumping in here. We've got full free text, rich text entry here, so you can add hyperlinks and you can customize this in whatever way you need to. In the findings, we'll be uploading things like maybe you have a verbal statement from a witness, you didn't get a signed statement, but you decided to transcribe it and put it in. You can have something like that in here. You could also have an actual signed witness statement uploaded as a PDF. If you click it like this, you have a built-in PDF viewer. Unfortunately, it's decided to do a security scan here, but you could download that PDF from here, or you can upload any additional PDFs. And this one, if I jump back into it, is actually associated with somebody listed on this investigations people involved section. So in this section, we have the name of the person who was injured. We've got people from the safety team. So I'm logged in currently as Champ Gibson. We've got other safety team members that may be involved in the investigation. We also have collaborators. So perhaps there's somebody in a different department who is helping out and you want to keep track of that person's involvement in this incident. And then we have witnesses. So Dwight was one of the witnesses. He's a warehouse operative that works with the person that was injured. And then maybe you have external people. So maybe there was a delivery guy on site that day, happened to see what was happening. And as you went to interview people, you got a witness statement from them as well. We can add external people who are not users in the system, just kind of a one-off person that was there that day. And we're also going to want to have some tools to mitigate and prevent this incident from happening. So first thing you're going to want to do after gathering all this information, or as you gather this information, is going to be to conduct root cause analyses. So we can add multiple root cause analyses to the investigation workbench. Currently, we have this set up for the 5 whys. We can also add actions directly to these root cause analyses. If we add actions to the root cause analysis, it will also show up here at the top level of the investigation. We have some open actions already in here. You can see they're color coded for if they're corrective or preventive actions. This is how your action form looks. You can see that we can assign actions, we can give them due dates, we can apply people to a watch list so they can keep an eye on it, and we can prioritize them. So this is pretty much the process for conducting an investigation. You can close out your investigation, close out your incident once the investigation is closed out, that's related to it. And next, what I'll show you is another persona. So we mentioned earlier that we have a new role that is coming with this, that comes with this release, which is required by your users to be able to use the new OSHA plugin that we mentioned. So I'm going to impersonate a user that has that role, and that is Christopher. So Christopher is a safety compliance manager for this company, and he will also jump into the workspace, and he will manage, one thing he will manage is the establishment list. So your establishment list will list all of the establishments that your company has, and it will have things like the address and the NAICS code for the establishment location in the US. He will also manage the recordable incidents on the injury and illness list. And looking at this injury and illness list, he has one extra functionality that other users that don't have this role will not have. He has the Generate OSHA Forms button. So in here, we can also click if we had many injuries and illnesses and some were recordable and some were not, we can click the recordable list and it will give you the same items that will show up on the OSHA 300 log. And in order to export that, we click this button here, and we can actually choose whether it's an OSHA 300 or an OSHA 300A. We can also choose which establishment we're generating that for, and we can also choose the year. So let's say I wanted to do this for the previous year. I would choose 2022 and then click generate. So it generates that form as a PDF. It fills in all of the recordable injuries. And it also gives me a link directly to that to download that PDF. The PDF looks something like this. So you can see that we've got 2 recordable injuries for that year. Okay. So just need to jump back into this one. Also, if I jump into one of these injuries, I can generate the OSHA 301 form. So this is another ability of the compliance officer role, is they have access to this functionality. I can click this button here, and it will generate your OSHA 301 form and attach it directly to that injury record. And that is how that one looks. So that is pretty much it for the health and safety demo. Any questions at all, please put them into the Q&A, and I'd be happy to answer. Thank you. I'm going to pass it over now to Claire.
Awesome. Thank you, Shayna. And let me get my screen shared. And as we go into our next portion of implementation tips, I'm going to kick off a poll. So we have 2 polls. I'll launch one now, and then I'll launch one at the end. So let me see if this is the correct one. Oh, no, it's not. Let me go back. Let's see if I can I relaunch? No. We'll keep that one as our first one, and then we'll go to our second one. So following what Shayna just showed, out of the 3 main aspects of employee health and safety, what is your highest priority after safety? We're seeing some good results on our poll. And we'll give it a few more seconds here. All right. Okay, so thank you for interacting with our poll. I'll end it. And so it looks like out of our audience today, the highest priority after safety is health. So that was helpful for our team to know as we're going through our strategy for the product going forward. So now let's get into some implementation tips. I have prepared 5 tips today for us to go through, but at any point, if you have any more questions, again, please feel free to put them in the question and answer portion down below. So starting off for our first tip is, what are the out-of-the-box role? I know that Shana kept referencing some of them during his demo. So to cover what are the out-of-the-box roles and responsibilities, health and safety has 6 that are out of the box. With any of these, though, and with ServiceNow, you have the ability to create your own specific roles to fit your unique requirements. And with these roles and responsibilities, you can mix and match the roles and responsibilities. So if you wanted to have a safety agent role with also a safety compliance manager role for one individual, you have the full ability to give multiple roles to one person. So starting off with our first role is our safety administrator role. This would be your admin, and this individual would be able to configure the health and safety incident management application. So ideally, the individual that would walk through some of the tips that we are doing later on in my presentation. They have read and write ability and the ability to create access to health and safety data. And then they also can grant others the health and safety incident management roles. So with our safety admin, you're probably going to want to only give that to one individual in your organization and not give admin rights to a ton of individuals. Our next role is our safety agent. So when Shana walked through the workspace today and and doing the investigation process, assigning out corrective and preventative actions, that individual would have the safety agent role. So with this safety agent, they can view the overall status of incidents and observations, and then they can also work on safety incidents and observations to complete an investigation. Our third role here is our safety compliance manager. And so this individual would be able to manage that list of establishments, review and determine which injuries and illnesses are recordable, as well as being able to access and report and create the reports for OSHA 300, 300A, and 301 incident reports. So again, you'll probably only want to give 1 or 2 individuals, maybe more depending on your organization, the safety compliance manager role, but not giving everyone in your organization this role. Okay, so our next 3 roles and responsibilities. The first one is our safety manager role. This is the manager of the team. They can reassign safety incidents. If you wanted to do manual assignment, they'd be able to manage their team that way. They have a high level visibility of all the safety assignments or incidents and observations that are being submitted, and they can work on safety incidents and observations themselves if needed. Our second role here is a little bit different. This would be that of the employee or an individual in your organization that is maybe a contractor as well, if you wanted to give them that role. And they are our safety requesters. So they are the ones that can report safety incidents and observations either from the employee service center or the Now mobile app. The last role and responsibility that I'll cover is our sensitive content user. And this is the ability for a safety agent to see sensitive content such as incidents. So if you determined specific incidents that are submitted from the safety requester are sensitive, they contain sensitive information, you can only have them view that type of information and have a little bit more control over that visibility. Okay, so our next tip here is our health and safety property. And for that, I'll walk us through our demo instance as our admin. So again, the individual would have the health and safety admin role. And within our OHS application properties, you must ensure as part of your implementation that the total hours worked value is populated with your company's total annual hours worked. So for this, in our demo instance, we have an example of total hours worked, but as you're going through implementation, you would put your own total hours worked. You calculate that out for depending on your company. And this will generate the safety frequency rate metrics on the health and safety workspace. So within those performance analytics, they are going to be based on your company's total hours worked. So you just have to make sure that you are populating this field here. Okay, so our next tip, our third tip here are what are the out-of-the-box requests and do I need to use them all? So for this, we'll actually start in our employee center just to give a refresh for those that aren't as familiar with our health and safety tool. And so our employee is able to come in. Our employee here has the health and safety requester role. She is able to come in and see all of the requests that are available to her. And so for your organization and for your employee experience, you might want to turn some of these requests off so you can have as many or as little as you would like. And so we'll walk through actually how to turn those off. So switching back to our admin role within our record producers, and I have it favorited here, but what you would do is search at the top, filter out record producers, and then from that record producer, make sure you're filtering out the health and safety application for health and safety incident management. And we can see here we have 56 record producers. So that is a lot of record producers. It showcases how much out of the box functionality that ServiceNow has for our incident management here. But for those that want to turn off some of those incidents or observations on the employee center side, you have two options. Either you can indicate this as and click in from the list view, indicate it as true or false, or we can actually drill in, we'll click in at the record level and indicate it as true or false within there. So we'll get that loaded up. If I don't click too many times, it will load for us. And we can indicate that as active. Again, you will need to have that specific role of the health and safety admin. You don't want everyone on your team being able to turn records on and off. So only a few individuals would have this role. So we can indicate that as active. Okay, so we now just covered what are the out-of-the-box requests. Do I need to use them all? No, you do not. At the bare minimum, you probably will want to have the health and safety observation and the health and safety incident. But if you wanted to enhance your user's experience, have specific ones for slips, falls, ladders, spills, you can use the ones that are out of the box or create new ones as well. Our fourth question here is, how can I change categories on an incident or observation? So to refresh, we'll go back to our employees view. And we will click into an observation here. Refresh it so it loads. And as your employee is filling out our observation here, they are going to be able to select from these drop downs in order to fill out the appropriate amount of information. This is beneficial for your employees so that all of the information that they need to submit is collected on the first go around. So we're able to choose from these drop downs. We can indicate them as mandatory or not. And one of the most frequently asked questions we get are, can you change those? So we'll walk through how we are able to do so. Back in our admin's view, we're back in that same area where we could indicate this as active or not. This is where you can change any of the information that is surfaced about that record producer for the employee. So if we needed to change the short description, if we wanted to redirect it to a different area in ServiceNow, if we needed to add images to enhance that user experience and really guide them to what type of information or to fit your company's branding, you have full control on what your employee's seeing and how they're able to, the experience that they have. Now, in order to change those variables and those drop downs, you will need to go into the variable set here. From that, go into the category. And within the category, you are able to add new question choices. Now, at current functionality, you can only add categories and to those drop downs. It will still keep the default that is out of the box. However, in our next release, again, safe harboring myself, but in our next release, you will be able to delete some of those categories as well and fully change them. Just right now, all you are able to do is add question choices or those category dropdowns. So we can add the text, the value, any information to that category that's needed, and it will add to those dropdowns. Okay, so our final question here is, how can I create routing? So once that incident or observation has been submitted to our health and safety team, either you have the ability to create one large queue and have someone manually reassign, but in the spirit of productivity, you'll probably want to also create some automatic assignment rules here. So with that, you have the flexibility to create those assignment rules and are able to do them based on category, location, if it's sensitive or not. If it's a sensitive location, for example, you can create one that's all slips that are sensitive, or I guess all incidents that are sensitive in the location of Boston. You can create those rules. So we'll walk through how to do that. You first will go into your assignment rules. So to get there, search in our filter up here to assignment rules, click new, and you have to change the name. So we'll just say webinar test. We have to make sure we're in the correct application. So health and safety management, and pulling from the correct table, which is our health and safety incident table. And from there, you can assign the different conditional filters. So if you wanted to do by keywords, by assigned to, this is where you create that if and then logic to do those assignment rules. Once you create how it applies, you then are able to create who it is going to. So how does this assign? And you're able to do that either by user or group. So if you wanted to create specific groups of your employees, best practice is to do it by group. You can then assign those groups off to begin working on those queues that you now have created. Okay, so that is everything I have prepared in terms of implementation tips. But if you do have your own implementation tip questions, please feel free to put them in the Q&A. I've seen some activity going on, so I'm assuming that Shana and Allison are quickly answering away. Our last thing that I actually want to do before we get into some of those Q&A and start answering that is our last poll of the day. So let's launch this poll. And where are you at in the implementation process? So I think that will also give us an understanding of where you're at and how we can help. So we'll take some time to go through this implementation poll, and then we'll get into some of those questions and answers. Okay, so we see a lot of activity. We see some people who haven't started but are excited for the webinar, and we're equally as excited for you to be here. We see some that are beginning to plan, and we see a few that have just kicked off. So that's really great to see that everyone is excited for health and safety and their possible or current implementation. So at this point, I'll leave this up. We can start answering some Q&A, and I'll invite Shana and Allison to come off mute if you have any questions there that we can all answer together. Let's end our poll now, and let's look at some of the questions.
Sure. Yeah, I can do a quick recap of some of the questions that have come in that we have answered in written format, and then maybe we can look at some of the new ones that have come in.
Yeah.
So we've gotten a couple of questions. One was around what plugin is required to install health and safety incident management. And as Shayna put in that Q&A answer, we actually have a health and safety incident management bundle. So that means we've made this easy. There are dependencies against that bundle, and installing that will install the requirements there. And then additionally, we have that OSHA plugin, which covers those OSHA reporting forms that we talked about. And on the topic of those OSHA forms, we also got a question, Claire, in the chat that we answered in writing around what all of those numbers and codes meant. So we provided some written information about those different forms and then provided a link out to the OSHA record keeping area of their site to just provide clarity on that. And then it looks like we got some other questions about some of the housekeeping. So we'll share this webinar after it ends. So we are recording. So the good news about this is once that is processed, we'll post this back to community and YouTube. So this will be available back for playback. And then it looks like we got a couple of other questions. So one, is it possible to add other record types, for example, environmental incidents? And so I think, Claire, this goes back to some of what you started to mention around the flexibility of those forms and turning them on or off. But either Shayna or Claire, I'll pass it to you to add some specifics there.
Sure. For environmental incidents specifically, we do out of the box have a record producer already there for environmental incidents. But you can add, if the out of the box list of record producers that we have doesn't cover your needs, it is possible to add those. I think Claire covered that in her section there. And there's another question there from Stacy about capturing the monthly hours by site for the OSHA rate. So this is what's covered by in the health and safety properties. You would put the hours that are required to generate your total recordable incident rate, your DART, and those kinds of incident rates. Those calculations are pulled from that number that we saw Claire entering into the health and safety properties just a few minutes ago.
Great, thank you. So it looks like we're caught up for now on questions in the Q&A and the chat.
Awesome. So we do have some other frequently asked questions that we can cover. We have some time here. So one, how are safety metrics calculated? So we've had seen with the properties, but the safety metrics are calculated from those incidents that have been submitted. And there is a performance analytics job that will run and generate those frequency rates. Our second frequently asked question is, can incidents and observations be submitted on mobile? Yes, both incidents and observations can be submitted on the Now mobile app or from the browser on your phone as well, giving employees the experience to submit it whenever and wherever that is most convenient for them. How can I get the OSHA content pack? It is right on our ServiceNow store to be downloaded. And then our last question is, can we create notifications? Yes, you can define when in each process notifications should be sent, who they should be sent to, and what they should contain. So if you needed to alert other members of the team, if you needed to alert an employee, whether it be a push notification, an email notification, you can create notifications around this whole process. So it looks like there are no other questions. We'll give it a little bit to see if any others trickle in, but we do have some additional resources as well. So if you do want to learn more about health and safety, we compiled some great resources here. So first, an essentials course on our Now Learning. Second, our community on ServiceNow for workplace service delivery has all of our health and safety content there. So if you have questions, want to see what others are doing, or take a look at the recording of this webinar. And then last, within Now Create, this is more documentation and steps on how to successfully or plans to deploy an implementation project. So be sure to check out Now Create for some more information as well. And that's everything that we have prepared in terms of our webinar today. Thank you again for taking out the time out of your day to join with us. And I hope you all have a wonderful rest of your day. And we're close to the weekend, so a great weekend as well. Thank you.
Thank you.
Thank you.